in the webinar number 131, organized by the Andean Health Organization, Hipólito Unánime Agreement. The cycle of webinars started on May 2020.
Es un aniversario muy sensible y significativo por el difícil momento que atravesamos. Sin embargo, como referente
However, as a reference in health, we continue uninterruptedly the joint and coordinated actions with the 6 member countries, Bolivia, Colombia, Chile, Ecuador, Peru, and Venezuela, thus fulfilling the goals and objectives to strengthen the health of our people. As a reference in health, we highlight that vaccination against COVID-19 is safe and effective in protecting ourselves and others. The more people who are immunized, the less likely they are to become infected. Make sure you and your families receive the second, third, or fourth dose as appropriate. There is no excuse to comply with the COVID-19 vaccination schedule. The socioeconomic and environmental context in Latin America and the Caribbean is a scenario in which hunger, food insecurity, and malnutrition has increased. Policy decisions are required to achieve sustainable, sufficient, inclusive, efficient agri-food systems that generate equal access to a healthy diet for all. Climate change threatens life, health, and well-being. However, we can contribute to its preservation from wherever we are, generating social policies and a sustainable development model by joining an initiative in defense of the environment, buying local products and plant-based products. We can use public transport, cycling, or walking, as well as reducing consumption, reusing, repairing, and recycling. It is everyone's duty to restore the relationship with nature. It is necessary to recognize the ancestral knowledge of native peoples who have lived in balance with Mother Earth and practice good living. Well, in accordance to what has been said today, Thursday, August 4th, we open our virtual doors to discuss a topic of great importance for our region, indigenous women in the preservation of traditional knowledge. We invite you to leave us your name, organization, and country from which you are joining us through the comment box of the Facebook live chat or YouTube live. In the same space, you can leave your questions or send them via email to webinarhorasconju@gmail.com. To access the certificate of attendance to this webinar, as usual, you must fill out a short survey and leave your data in the fixed link found in the Facebook live or YouTube live chats. The certificate will be sent to your email in the next few days. This webinar will be developed with the usual dynamics. We will start with the institutional greeting, then the presentation of our speakers, an active pause, and the space for Q&A. To begin this important day, I give the floor to Dr. María del Carmen Calle Dávila, Executive Secretary of Horas Conju, who will give the welcome and institutional greeting. Go ahead, Dr. Calle. Thank you, Gloria. Good morning. In some areas, good afternoon. I don't know if good evening, but I would like to give a welcome to all of those who are participating in this webinar number 131 of the Andean Health Organization Hipólito Unánime Agreement. A special greeting to Abeli Angel, coordinator of the ODS and Youth Program of the Fund for the Development of PILAC, to Avelina Apinti, Traditional Medicine, Ministry of Women and Vulnerable Populations, Office of Displacement, Shaninka, Unoli Fernandez, the General Director of the Zulia Academic Group from the University of Sciences of Health Sciences. And I believe we're going to have Vivian Camacho National Director of Traditional Medicine and Ancestral Medicine from the Ministry of Health and Sports from Bolivia. As you know, as is well known, interculturality is a transversal axis in the work that Horace Konu develops as a reference in health in the Andean region. In 2006, the Andean Intercultural Health Committee was organized, constituted, and many efforts have been made to incorporate interculturality into regional policies and plans, which have served as reference in drafting of national standards and plans, as can be seen in the references of the member countries. In the framework of the Andean Plan, important initiatives, research, and actions have been developed, highlighting the Andean Intercultural Health Policy in response to the mandate of the minister, approved on March 27, 2014, and updated in 2019. The research show us that we still take care of ourselves with our own medicine, and the perception of health and disease in the Aymara population as a referral and counter-referral system for the triple border of Bolivia, Chile, and Peru, among others. The United Nations General Assembly, during the International Decade of the World's Indigenous People, established the International Day of the World's Indigenous People in 1994 to be celebrated annually on August 9. It is in this framework that, committed to the theme, Horas Conju, our institution, has scheduled the webinar on the role of indigenous women in the preservation and transmission of traditional knowledge, with the aim of highlighting indigenous women as pillars of indigenous peoples, playing a crucial role in the preservation and transmission of traditional knowledge, and also to know the relevant role that they are developing for women leaders from Bolivia, Mexico, Peru, and Venezuela, who will share with us their valuable experiences with the desire to learn what is the current situation, their experiences, and identify future trends. Indian Health Organization, being consequent with their thoughts, last year participate in COP26, the Climate Change Summit, and we spoke about the importance of traditional medicine and the importance of having the dialogue of knowledge that at this moment being shared with these 6 countries in order to achieve an horizontal communication that allowed presentation and health of the populations of our 6 countries. We have the opportunity to learn and reflect on the historical relevance and cultural relevance of the indigenous people, and in particular on the situation and the important role that traditional medicine has in our original populations. It is for me a pleasure and pride to begin and welcome our speakers, to all the group from Horas Conju and all the participants who are with us every Thursday with the webinars that allow us this continuous learning. Welcome all.
Muchas gracias, doctora Calle.
Thank you,
Luego
Dr.
del
Calle.
saludo de nuestra
After the
presidenta,
greeting
me
of
presento.
our Executive
Mi
Secretary, I
nombre
will
es
introduce
Gloria
myself.
Lagosa
My
Izaguirre.
name is
Soy la
Gloria
gerente
Lagos
de áreas
Eizaguirre.
estratégicas
I'm the
internacionales
manager of
y
Strategic
internacionales
Lines and International
coordinadora de
Cooperation
los comités
and
directores
coordinator
del
of the Andean
Intercultural
Committee of
Health. Yo
Intercultural
estaré en
Health
la
of
voz
Forest Control,
de la
and I will be in
moderación
charge
de este
of the
webinar.
moderation of this webinar.
En esta oportunidad
On this
estarán con
occasion,
nosotros,
we will be
como
joined,
ya lo había señalado la
as
doctora Calle,
Dr. Calle
la
mentioned,
coordinadora del programa de
the
juventud indígena
coordinator of the
de
Indigenous Youth
TILAC,
Problem and
la
ODS of TILAC,
Ashánica de
the
Perú,
Ashaninka leader from Peru,
la directora del
and
Núcleo
the
Académico del
director of
Departamento
the
del
Academic
Zulia
Center
de
of
la
the state of
Universidad de
Zulia
Ciencias de la
of the
Salud, la
University of Health
directora del
Sciences of
Centro
Venezuela,
de
and the
Poblaciones
director
Indígenas
of Indigenous
del
Population
Ministerio de
from the
Desarrollo Social de
Ministry of
Bolivia.
Health and Sports from
Mujeres con
Bolivia.
larga trayectoria en la defensa de los derechos de
Women with a long
indígenas.
history in the defense of the rights of
Después de
indigenous
este
people.
preámbulo,
After this preamble, we will
voy a
begin this
poner
event
en
with a
diálogo a
presentation
Dalí
by
Ángel
Dali
Pérez,
Angel Perez,
indígena
an
zapoteca
indigenous
de Oaxaca, México.
Zapotec from
Dalí
Oaxaca,
fue
Mexico.
coordinadora del
Dali was a
Consejo Nacional
coordinator
de la
of the
Juventud
Indigenous
y
Youth and
Indígena de
Childhood
la
Commission
Organización de Mujeres
of the
Indígenas
Organization
por
of
Ciarena,
Indigenous
con
Women
sede en el
for
estado de
Ciarena,
Oaxaca,
based
México.
on the state of Oaxaca, Mexico.
Cofundadora de la Red
She
de
is the
Jóvenes
co-founder of
Indígenas
the
de América
Indigenous
Latina y el
Youth
Caribe,
Network of Latin
INDIGES,
America and the
y
Caribbean, and
caucus
former
global de
president
jóvenes
of
indígenas.
the
Actualmente
Global
es
Indigenous Youth
representante alterna
Caucus.
por
She
América
is
Latina y
currently
el Caribe
alternate
del
representative
Grupo
for
de
Latin America and
Trabajo
the
de
Caribbean
Pueblos
of the major group
Indígenas
of
y
indigenous
Desarrollo
peoples and
Sostenible,
sustainable development,
coordinadora del
coordinator
Programa de
of the
Desarrollo
Youth
y
and
el Desarrollo
Sustainable Development
Sostenible
Program
del Fondo
of the
para el
Fund for
Desarrollo
the
de Pueblos
Development of
Indígenas
Indigenous
de
Peoples in
América
Latin
Latina
America
y el
and the
Caribe,
Caribbean, TILAC.
Bienvenida, querida doctora.
Welcome,
Es suyo el
Dali.
espacio.
You have the floor.
Muchas gracias, querida
Thank
Gloria
you,
Lagos.
dear Gloria
Antes que nada,
Lagos.
quisiera
First of all,
agradecer la
I would like
invitación
to
para
thank for the
participar en este
invitation
importante
to
evento
participate
con
in
la
this
doctora María
important
del
event to
Carmen
Dr.
Calle
María
Dávila,
Carmen Calle
secretaria
Dávila,
ejecutiva del
Executive
Movimiento Andiano
Secretary of the
Juvenil,
Andean Health
saludar a
Organization,
las panelistas
to
Noli
greet the
Fernández, directora
panelist
general
Noli Fernandez,
de
Director General of the Zulia
Investigación
Academic
Dirigida de las
Center of the
Ciencias de la
University of
Salud,
Health Sciences,
Avelina Pinti,
and
del
Avelina
Ministerio de
Pinti from the
Mujeres,
Ministry of
Poblaciones
Women and
Indígenas y
Vulnerable
Territorios, que
Populations.
también se
I
suma la
understand
doctora Viviana
we also
Camacho,
Dr. Viviana Camacho,
viceministra de Medicina
Vice
Tradicional
Minister of
de Bolivia,
Traditional
y al
Medicine
resto de
from
panelistas
Bolivia,
que nos
and
acompañan.
to the people that are
Como
with
ya
us today.
presentado, traigo un
And as I have been,
coordinamiento a
I
nombre del
bring
Fondo para el
the
Desarrollo de los
greetings
Pueblos
on
Indígenas
behalf of the Fund
de
for the
América
Development of
Latina y
Indigenous
el
People for
Caribe,
Latin America and the
que es un
Caribbean, CILAC.
organismo
We are
intergubernamental
an intergovernmental
paritario con
institution
sede en
with
Bolivia.
our main office in
Por lo
Bolivia.
que entendemos
Well,
por
we
conocimiento
understand
tradicional el
traditional
saber, los
knowledge to
saberes y
be the
conocimientos de
diverse
pueblos
knowledge
indígenas
possessed by
son
indigenous people
transmitidos de
that is
generación en
transmitted from
generación,
generation to generation,
habitualmente de manera oral,
usually orally
creados en
and
contextos
developed
informales de
outside
educación
the
pública.
formal
Esos
education system.
conocimientos, si
This
bien
knowledge,
tienen origen
although of
ancestral, no
ancestral
están
origin,
exentos de
is not
procesos de
exempt of
actualización,
processes of
innovación
updating,
y
innovation,
adaptación a la
and
cambiante
adaptation
realidad.
to the changing
El
reality.
derecho de los pueblos
The right
indígenas a
of
preservar,
indigenous peoples to
controlar
protect,
y
control,
desarrollar sus
and
conocimientos
develop their
tradicionales
traditional
es
knowledge has
reconocido por
legal
la UNESCO,
recognition,
entre otros
among other
instrumentos, a
instruments,
través de la
through the
Declaración
United
Universal de
Nations
los
Declaration of the
Derechos de
Rights
los
of
Pueblos
Indigenous
Indígenas,
People,
aprobada el
approved
13 de
on
septiembre
September
de
13,
2007,
2007,
donde en sus
where
artículos
in its
12
Article
menciona
12,
que
it
los
mentions that
pueblos
indigenous
indígenas
people have
deben
the right
manifestar,
to manifest,
practicar,
practice,
desarrollar
develop,
y enseñar
and teach
sus tradiciones y
their
costumbres
spiritual and
religiosas,
religious
espirituales y
traditions,
religiosas.
customs, and
El artículo
ceremonies.
13 menciona que
In
los
Article
pueblos
13
indígenas
mentions
tienen
that
derecho a
indigenous people have the
revitalizar,
right to
utilizar,
revitalize, use,
transmitir y
promote,
transmitir a
and
las
transmit
generaciones
to
futuras
future
su
generations
historia,
their
sus
histories,
idiomas,
languages,
tradiciones
oral
orales,
traditions,
filosofías,
philosophies,
sistemas de
writing
escritura y
systems,
literaturas y a
and
conferir
literatures,
nombres a
and to
sus
designate
comunidades
and
y
retain the
lugares y
names of their
personas,
communities,
sino para
places, and
entenderlos.
persons.
Sin embargo, lo que ha
However,
caracterizado las
what has
relaciones entre los pueblos
characterized
diversos
relations between
es la
diverse cultures
desigualdad.
has been
Para los
inequality.
pueblos indígenas de
For
la
the
región y
indigenous
del mundo,
peoples of the
el
region and
dominio
of
ha
the world,
sido la
the rule has
apropiación,
been the
la
appropriation
expropiación de sus
and
saberes.
plundering of the
Esto se ha
knowledge.
venido dando hasta el
This has
presente.
been the case up to
Pero
the
¿por qué son
present.
tan relevantes los
Why is
conocimientos
the ancestral
ancestrales de
knowledge
los
of
pueblos
indigenous
indígenas?
people so relevant?
Bueno, porque han perdurado a lo
Because
largo de
they
los
have
siglos
endured
y su
over time,
aplicación en el
and their
presente
application in
demuestra
the
que son
present
útiles.
demonstrates that they're
Están
useful.
basados en
They are
relatos,
based on
historias
historical practices that reveal, without a doubt, not only their capacity to solve the problems they address, but also demonstrate their remarkable adaptability to the physical and social changes that they have faced. In other words, they are not one of emergencies. They are not isolated initiatives of questionable sustainability, nor do they respond to monetary or momentary interests. On the contrary, it is through the action of the worldview of the world that has been maintained for generations, demonstrating their full integration into the environment and coexistence with nature, among other aspects to be highlighted. In addition, this knowledge, which is key in vital areas such as food security, health, conservation of animal and plant species, gives constant proof that they do not oppose or reject changes, innovations, and adaptability to new techniques and circumstances. Indigenous women have been and are currently fundamental for the defense of self-determination of the territory, spirituality, social, political, and economic systems compatible with the natural laws of Mother Earth, and in general for the preservation of the culture of indigenous people. Indigenous women in their territories, communities, and organizations have contributed to self-organized processes of preservation of life and management of family and community care, and the questioning of governments regarding the lack of basic services. In the context of this pandemic, according to data from the reports of the Observatory of Indigenous People of FILAC, the contribution made by indigenous women, youth, and all rural and urban made it possible for indigenous peoples to demonstrate their remarkable resilience to the impact of COVID-19, and in the current context have proven to be essential for the revitalization of traditional knowledge, intergenerational transmission, conservation, and transmission of indigenous languages, for the coordination of individual and collective self-care actions, and for the application of traditional ancestral medicine. Allow me to share that within the framework of the fourth regional conference on population and development, carried out in Santiago de Chile, we presented a document entitled Blooms of Life Report of Indigenous Youth, Effect of the Pandemic and Public Policy, in coordination with a network of indigenous youth and the support of the United Nations Population Fund, with the aim of generating a reference document for states, international agencies, and indigenous youth organizations, promote the generation and implementation of inclusive and cross-cutting public policies on indigenous youth by state. There, indigenous youth consider that a central element for their integral empowerment is a transmission of traditional knowledge through intergenerational dialogue and practices. The transmission of culture is of particular interest to indigenous youth. They are concerned that much knowledge and cultural elements are being lost due to the lack of transmission. At the same time, the limited control of indigenous people over their traditional expressions is worrying, allowing third parties to control cultural elements that are sacred, secret, and sensitive. The lack of control, coupled with discrimination, creates stereotypes that damage the integrity of new generations. In the context of the pandemic, the new generations recognize the millenary health knowledge of their peoples and generated initiatives to face the health crisis with their communities. To mention a few examples, pandemic prevention campaign in indigenous languages through messages, radio programs, and the use of ICTs, territorial and social control in their villages and communities with youth, indigenous guards, and strengthening of intergenerational dialogues, culture, food sovereignty, and food security and indigenous arts. However, despite some progress made by some states in the national recognition of traditional medicine through laws, as is the case of the Vice Ministry of Traditional Medicine in Bolivia, to mention one example, we have confirmed in some reports from the Observatory of Indigenous Peoples of FILAC that even in extraordinary critical situations, indigenous peoples, women, and youth are not adequately considered and included in the public policies of most states in the Latin American and Caribbean region. Basic public services, in general terms, are not designed for indigenous people, nor do they adequately reach to rural urban communities. Indigenous people practically do not appear in statistical data, much less in data by gender and age. age range. For all these reasons, it is necessary to construct and use health variables and indicators, and in general, intercultural indicators, respecting the diverse ways of seeing the world of the people who live together on this planet. It is necessary to take into account that when talking about peoples, about their own cultures, an approach that integrates medical science with ancestral knowledge and practices, including languages and traditional medicines, among others, is essential. Communities that have always resorted to their ancestral ways of relating to nature and their own bodies cannot be invited by other types of practices without negative consequences, perhaps worse than the evils that they wish to avoid. Not only a matter of adding the ethnic category to the collection and dissemination of data, it's also a matter of ensuring that the elaboration of this data is carried out within the framework of a dialogue of knowledge. This implies that what is to be known, what is so to be investigated, should not only come from an epistemological perspective, but should also contemplate and include other visions. Now, as before, it is abundantly clear that indigenous people, women, and youth have much to contribute to health, to prevent, treat, and cure diseases, as well as to respond to the crisis facing humanity. Time that this is perceived, recognized, respected, and considered by society as a whole. Indigenous people have much to say and to share in the search for concrete solutions to current problems, sometimes in combination with modern scientific and technological knowledge, other times giving support to their ancestral practice. For the reason, events such as those organized by the World Health Organization allow us to exchange experiences, best practices and lessons learned, which will allow us to articulate and join actions in favor of the rights of indigenous people, women, and youth. Thank you very much.
Perdón, estaba hablando con el micrófono apagado. Agradecemos
We thank the
the
intervention of Dalí Ángel Pérez. We highlight that despite the crucial role that indigenous women play in their cities as caretakers and guards of knowledge and defend human rights, many times they suffer discrimination due to gender, ethnic, social, economic issues. The indigenous women, as Dalí mentioned, are local leaders, national leaders, and are defending their land, their culture, and their people. However, the reality is still that the indigenous people are very well underrepresented and frequently are victims of discrimination and violence. She also highlighted that traditional medicine is still alive. We still take care with our own medicine, and we should respect it through knowledge, through recognition, with a clear methodology such as knowledge dialogue. Thank you so much, dear Dalí. And now we invite you to stay in the room. At the end, we will have a dialogue in response to the questions from the participants. Now, we would like to welcome Avelina Ampinti, a nurse technician and psychologist. She's an Ashaninka professional belonging to the Arawak linguistic family from the central jungle of Peru. She is currently pursuing a master's degree in intercultural bilingual education at the Universidad Nacional Mayor de San Marcos. Collaborator in community work with the Faculty of Psychology of the Autonomous University of Mexico in the year 2020-2022. She has extensive experience in community work with indigenous populations, Ashaninkas and Nomatsigüenga, specialists in preventive health promotion with work in private and public institutions, such as the Amazon Center for Anthropology and Practical Application, Health Without Limits, Caritas of Peru, as well as the district municipality of Rio Tambo, serving as manager of indigenous people and in the literacy program of the regional government of Junín. She is a pedagogical accompanist for students of intercultural bilingual education at the Universidad Peruana Cayetano Heredia, and provide support to people rescued from armed groups in the direction in the Office of Displaced Persons and Cultural Peace of the Ministry of Women and Vulnerable Populations. Is promoter of the creation of the Intercultural Indigenous Health Association of the Central Jungle of Peru, member of the Urdimbre Intercultural Volunteer of the Universidad Peruana Cayetano Heredia, motivator of young indigenous people in the consolidation of their dreams as professionals in different universities in the country, and promotes the Ashaninka gastronomy. Welcome, dear Adelina. You have the floor. Go ahead, please. I would like to greet everyone in this morning, especially Dr. Gloria Lagos, to my fellow friend here in this room, to Noli Dali. I've paid very close attention to her presentation. I will thank Horace Conhu for the invitation and to be part of this event and share a working experience in traditional health and intercultural health. Allow me to show you my small presentation.
¿Está en proceso ya? Ok, ahora sí. Abelina, tendrías que ponerlo en modo presentación nada más para verlo con pantalla completa.
Listo.
En la parte de abajo, a tu derecha. Listo.
Bien.
Okay.
Para mí es gracias.
Thank you. It is for me a great honor to share with you our experience in Peru in Achaninka's populations. Topic of my presentation today that I'm going to share is called Preservation of Traditional Medicine in the Ashanikan People. This effort that we've been carried out in the Ashanikan people, the Ashanika people belongs to the Arawak linguistic family with the greatest Amazonic influence in Peru. More than 120 native communities located in the Rupa Rupa and Omagua region, high jungle and low jungle on the slopes and tributaries of the Apurimac, Mantaro, N, Perenet, Tambo, Urubamba, and Ucuyali rivers. And the word Ashaninka has an inclusive sense that translates as people, countryman, or our family, according to the Ministry of Culture in the research effort. The geographical location, we're going to find the regions where the Ashanika people is located. On the left side, we see regions where they are found, and on the right, we're going to see the Rio Tambo district where we're working with this experience with ancestral medicine. We have found traditional medicine, according to the WHO, that is defined as knowledge, practices, approaches, and diverse health beliefs that incorporate medicine based on plants, animals, and minerals, as well as spiritual therapies, manual techniques, and exercises applied individually or in combination to maintain wellness, as well as to treat, diagnose, and prevent diseases through plants from the area. According to SENSI, the National Institute of Health, to the Executive Office of Traditional Medicine, investigates traditional systems and their technologies with a comprehensive socio-anthropological and sanitary approach of the Amazonian and Andean indigenous people in the Afro-Peruvian population. In that regard, it trains and transfers technology to achieve culturally relevant health services and promote disease prevention and control, and also the new diseases that are being now. On the other hand,
Sí, Avelina, está avanzando.
Gracias. Dentro de los conocimientos sobre las plantas medicinales,
Among the knowledge about medicinal plants, the indigenous population has developed for centuries knowledge and health practices based on their experience, constituting the health system that incorporates other forms of relationship in their healing procedures. In this way, we have considered the cultural syndromes. We have, for example, the process
de presentar los síndromes
of presenting syndromes,
de algunas dolencias o
of
malestares
some
patológicos
maladies
dentro de las
or
personas,
symptomatology.
por ejemplo,
People, for example,
por ejemplo,
the
el
so-called
problema del arco iris,
the
el
problem of
problema
the
del
rainbow
chacho,
or
o lo que
chacho,
la ciencia no puede
or what
diagnosticar
the
en un
science cannot
momento, pero
diagnose
sí
at this moment.
digamos, las
But let's
tradiciones
say
medicinales
traditions
tradicional puede,
and
digamos, curar
traditional
las
medicine can
enfermedades a través de
cure
las plantas.
this condition
También
through
tenemos, por
plants.
ejemplo, la
We also have,
cosmovisión.
for
Dentro
example,
de
the
ello vamos a
cosmovision.
encontrar
And here we're going to
la
find
alimentación en gestante,
in feeding in pregnant
que
women
tiene que ver muchísimo
that has to
con
do
las
with
creencias de
the
digamos, tener ciertas
beliefs
restricciones
of
y
having some
limitación en cuanto
restrictions
al
in
proceso
food
y tiempo de
with regards to
gestación.
the process and
Asimismo,
gestational age.
también la alimentación
Also,
en general, por ejemplo, en
feeding in
niñas, tiene que
general
ver
in
mucho
children that has
con
to
la
do
astrología, ¿no? El
with
tratamiento de
astrology.
enfermedades. Es decir,
That
que la
is,
alimentación en niños
that
se
feeding in
basa
children has to
pues en la
be
presentación de la luna
based
llena.
on the full moon
También
presentation so the
obtener pues
child
no la digamos el
can
crecimiento
have the
adecuado y
adequate
pueda pues
growth
tener el peso necesario.
and achieve
Asimismo, en
the
el tratamiento
adequate
de
weight.
enfermedades tiene que
Also,
ver
in the treatment
con
of diseases,
la
that
posición de la
has to
luna
be with
nueva
the position of the
particular en el caso de la desparasitación
new
y
moon
pueden,
for
digamos, tener un efecto
treatment
pues
of parasitic
digamos, en el tratamiento
infestations
de estas medicinas.
and can have some effect with the use of these
Asimismo, respetan
medicines.
la madre
They
naturaleza
also
a
respect
través
Mother
del
Nature
agua,
through
tierra,
water,
fuego,
land,
aire,
soil,
es
air,
decir,
fire, trees.
que las
That is,
personas o los
that
niños
the people
recién
or
nacidos que pasan en
newborns
un área donde
who
los
are in an
ríos
area, go through an
eh,
area where the water
se
is there,
tiene, digamos, la idea de
they
que
have
el niño es
the
absorbido,
impression
el
that
espíritu del niño es absorbido
the
a
spirit of
través
the
de las
child is
energías del
absorbed
agua,
through
de las energías
energy of the
del
water or the
atardecer
energy of
o
the
de otras,
mountain
digamos, de otros lugares
or
que
other
pueden ser
areas
en el proceso del
that
tiempo
may
presentar algunas dolencias o
in the
enfermedades.
in
Pero
time
a
the
su vez
child is going to
se hace
present
un
some condition or
tratamiento con las
disease.
plantas
So
a
we treat
través
them with plant
de los
with the aid
curanderos o sheripianos,
of
¿no? Que
the
le
shady
llamamos
piares
en
or
selva.
healers, as we call them in the jungle.
Por otro lado,
On the other hand,
también tenemos los ritos. En
we
este
have
caso,
the rights.
se va a
In this
emplear
case, we're going
estos
to use
sistemas rituales
this
desde el
ritual
nacimiento de un
systems
nuevo ser, por
from
ejemplo,
the
el día de
birth
la
of a new being,
presentación.
the
Eso quiere
Dimo
decir de que las
Kota
personas que han
City,
tenido, que
which
han
means that
nacido
the
en los
child that's
lugares
born,
donde restringen,
their
digamos, la
parents
dieta y
restrict
las salidas de actividades
the
reproductivas
diets
con
and
el
the
objetivo,
productive
pues, de
activities in order to
resguardar la salud del niño.
save and treat
Asimismo,
and do
no
care
accidentes
for the
laborales
child.
como por ejemplo mordedura de
In the event of a
serpiente,
snake bite
¿no? Las
accident,
personas que son,
people
digamos, que
who
están con esos accidentes tienen
suffer
algún
that
tiempo,
event
digamos, de reserva para
have a
poder,
limited
pues,
time
cumplir una
in
dieta para
and
que
follow a
pueda
diet
poderse recuperar esas
so
personas
they
que han
can
sido, pues,
recover their health
accidentalmente mordidas.
that were accidentally
También
bitten by
ante el
a snake.
fallecimiento de un ser querido,
Upon the death of a loved
también se
one,
cumple ciertas
they
dietas,
also follow
o se
specific
desarma la
diets.
vivienda donde está porque el espíritu
They
del
pull
fallecido,
apart
como le
the
llamamos
household of the
en
deceased.
Ichire Kaminkari,
What we call
queda,
the
digamos,
Ichire
atrapado en la
Kaminkari
vivienda.
is
Y
trapped
por
in the
ello
household.
también a través
That
de
is
las
why
plantas del uso, por
through
ejemplo,
the use of
del
plants
tabaco, a
of
través, por
tobacco
ejemplo, de
plant
la verbena,
or
para que
verbena,
pueda inducirse al
so
vómito,
we
¿no?
can
Y
induce
crear
vomiting
una nueva persona
and
con nuevas
create a new
energías y
person
termina
with new
limpiando
energy
la
as a
persona
cleansing inside the
y no vuelva
person
a repetir nuevamente
and
el
would
problema que
not
se haya
repeat
suscitado, ¿no?
the problem that
Por
would
otro lado,
suffer.
también tenemos los agentes
On the other hand, we have
tradicionales
the
químicos
agents
o
of
principios
traditional medicines
transportadores
who are the contribute to transmit the ancestral knowledge, and it is through steaming, through the leaves as a sauna. In this way, the person can clean their body and receive new energy and is getting rid of all the impurities received by those negative energies. Also, through blow with tobacco, we have the sheripiari. Through the cigar or tobacco can clean the person and learn what damage this person has. Also, the presence of bone specialists who perform rubbing therapies and detect the dislocation problem in the patient, and also the herbalists of those who are working, and we are strengthening the system because it has been found that we have a large potential in our communities through our plants. And this has been used through the Sipanahampi Association in Satipo, in Rio Tambo, who have been carrying out this process to strengthen and revitalize plants through this procedure. There we have the presence of the Ashaninka doctor who is leading this association. We also find the properties and uses and property of medicinal plants, and with this COVID-19 sanitary emergency, today people have used plant for as a decongestant, cell regenerator, prolactin stimulator that has been found in patients who have undergone surgery, and many of them have hormonal conditions. So these are the properties of these plants that are contributing to the health and improvement of people. Finally, we have the preservation of medicinal plants. It's interesting to learn and know in order to practice and share, and through the implementation of botanical gardens or workshops, internships, and also with educational campaigns through the implementation through programs in local government and the Ministry of Health. This has been work in the Ministry of Health and the Ministry of Culture in our dear country of Peru. However, there's still the need to strengthen this in order to spread these practices and establish them as a daily practice. For example, we have some foods and some plants and some animals and minerals that also contribute in improving health. It is important, right, to identify the allies for preservation of traditional medicine. In this case, for example, we have identified the Ashaninkan Communal Reserve in the region of Junín in Rio Tambo district, as well as the Otishi National Park and the Avireri Biosphere Reserve, which are allies that carry out these efforts of preservation and conservation as part of areas. However, it is also important to mention that transmission of ancestral knowledge and indigenous is important to the families. It's also important to highlight intercultural schools, but also the wise and the parents, the grandparents, and the elderly of the family. Those are the ones who transfer the knowledge, but we need to strengthen it as a level of public institutions such as the local government and the municipalities through communal drugstores and the promotion of health, and in the Ministry of Health through the offices of indigenous people, so we can work in this area and strengthen this area. Likewise, at the community level, we've been working through institutions and efforts with the indigenous people. And with that, I would like to thank you so much for your attention, and thank you so much for this opportunity. Pasonki, which is thank you. We thank the intervention of Adelina, who shared this joint effort carried out, highlighting training, and with the National Office of Indigenous People, highlighting training and technology transfer to achieve health services that are culturally sensitive and promoting prevention and control of diseases. He also highlighted how the indigenous population has developed for centuries knowledge and practices of health based on their experience, and this has become a health system that incorporates cosmovision and cultural aspects in their healing processes. He also highlighted the importance of the agents of traditional medicine who, through their practices, they maintain traditional medicine alive, as for example, how they manage medicinal plants by having botanical gardens, workshops, educational campaigns, implementation through programs with local governments and Ministry of Health. The preservation of traditional medicine, as Avelina mentioned, is through the family, the wives, the elderly, parents, but also through the intercultural schools, which should be strengthened, as she suggests, and for that, inviting regional governments to contribute. My dear Avelina, thank you again for your lecture, and we invite you to remain in the room. At the end, we will have a dialogue in response to the questions from the participants. Before continuing with the next lecture, we would like to greet all those who are connected and have joined us from the 6 countries of Central America, Mexico, the US, Spain, as well as from the public and private institutions, highlighting the 6 ministries of health of the member countries of the Andean Health Organization. Thank you very much to all of you who week after week join us. Now we welcome Noli Hernandez, a Venezuelan physician with a master's degree in administration and public management, as well as in science for strategic development, specialist in health sector administration, specialist in public health with mention in epidemiology, doctorate in public health. He is currently the general director of the academic nucleus of the Zulia State of the University of Health Sciences of Venezuela. She was president of the Andean Committee of the Intercultural Health of Orascon for 5 consecutive years. She was the Vice Minister of Hospital Network in 2016 and Vice Minister of Comprehensive Health in 2017 of the Ministry of People's Power for Health. She was the National Director of Indigenous Health for 7 years, Director of the University Hospital of Maracaibo for 3 years, and she has a great academic and political trajectory in the defense of the health of indigenous. Welcome, dear Noli. You have the space is yours. Go ahead. Good morning. Greetings, fraternal greetings from Guajira. No borders from the Guajira, where it has a wide spatial territory. I would like to thank on behalf of our culture and the knowledge of the Wayu people of the more than 42 indigenous people of Venezuela. I would like to express the active participation of women who are fighting to protect and transmit ancestral knowledge and our traditions. It is an honor for me to be the voice or the speaker of the Wayu world that have allowed us to learn and have sacred experiences. And this would also like to thank the Andean Health Organization, Hipólito Unánime Agreement, which I consider one of my schools in the intercultural space. still providing effort support to our Andean countries, respecting our knowledge and the political lines on health, respecting and understanding. And I would also like to thank all who make possible our participation in the brotherhood and reevaluation of social and spiritual values of la Via Ayala, respecting and recognizing the difference of the cultural difference. We would like to preserve the spirit of the system of knowledge of our YU. We know that our thought, our thinking is a way of life for mankind, for humankind. From our spirituality, we have a profound respect for Mother Earth, the old mother, and where we recognize the sacred value of life in all forms and manifestations. So we would like to continue in this horizon of this recognition and living together in a society that understands and is plural and respectful. In the difficult times, it is our turn under a civilization crisis and a ethical value crisis in all the cultures of the planet. I would like at this moment to start this discussion of how YU, for thousands of years, we've worked with this knowledge in the preservation of the different stages that this society, global world has undergone. Gloria, could you allow me to share my screen, please?
Adelante.
Yes,
Tienes abierto
go
para
ahead.
poder compartirlo. ¿O deseas que lo compartamos nosotros?
Sí, por favor.
¿Sí?
No estoy muy ducha.
Ajá, ¿me
Sí.
ayudan, por favor?
Creo que es acá.
Danos un segundo.
Give us a second, please.
Listo, querida Noli.
Ok.
Okay, dear Noli.
Siguiente. ¿Cómo le doy acá? Yo misma puedo.
Noli, ya está tu presentación en la pantalla.
Noli, you can see your presentation
Bueno, un
on
poco para
screen.
dibujar desde la República
Show you
Bolivariana de
from the
Venezuela,
Bolivarian
¿dónde
Republic
estamos
of
los
Venezuela,
Estamos
where the YU
hacia
is
el
located.
occidente y el
We are
norte
towards the
está
west and the
el
north
territorio nacional.
of the
Nosotros
national
tenemos
territory, where we share
en este territorio del estado Zulia con
this
5 pueblos
Ulia
indígenas,
with 5
donde
indigenous
el pueblo
people,
Wayuu,
where the
al igual
YU,
que el
as
Pura
well
y el Barí,
as the
nos
others,
compartimos con la
share
República de Colombia.
with the Republic of Colombia. Next slide, please.
Siguiente.
The next slide, please.
Ok. Realmente el territorio
This
para el mundo
territory
Wayuu
for the
importante
YU
porque es donde
people is
desarrollamos
important
todas
because
esas
that's where we
tareas, todas
develop and carry
estas
out all that knowledge
interpretaciones que
and
recibimos de la
interpretations
Madre
that we
Tierra,
receive from Mother Earth,
donde los poderes
where
sobrenaturales
the
forman
supernatural
parte
powers
de
are
ese
part
orden de
of
creencias,
that order of belief,
donde forman parte de ese
where they are
espacio donde
part of that
desarrollamos
space where we
nuestras
carry out
costumbres, nuestras
our
tradiciones que
traditions
obedecen a
that
ese orden de vida
follow that
que
life order
tiene el mundo Wayuu.
the YU world has. Next slide.
La concepción
The conception
que se tiene
that we have
de
about
la vida, la muerte,
life,
la
death,
salud y la
health,
enfermedad
and disease
tienen unas características
has
muy importantes
very important characteristics for the Wayu people. Complex systems of beliefs. When we are born, we receive the role that we have in the Wayu society. You are a man or a woman in a space of equality with no competition. In terms that death is the step to another space of our spirituality. The organic body dies, but the spiritual life continues and continues to protect those who are with an organic body that's alive. There is a philosophy of its own, a social organization that of our own, where the woman has the responsibility to preserve the culture, the life, to preserve collective well-being through plans. We're a matrilineal society where we occupy a very important role as healers, caregivers, advisors, but without competing with the important role that men have. And we also have an own procedure in traditional medicine, where we have our own system, where we have preventive medicine, where we have a very important aspect in healthcare and different with Western medicine or scientific medicine or Arigona medicine that we call the other cultures, where we are based on care since birth until we depart to the spiritual world. The next slide, please. So this traditional medicine has two origins. It has an ayuli, which is natural or organic origin. The heart is diseased, the stomach is diseased, is ill. But we have another origin that we call spiritual or supernatural, which is Wanulu. Wanulu develops through the ruptures that we have inside the Wayu society. For example, a pregnant woman cannot walk a certain hour of the night because the Purowis or the bodies who voluntarily or involuntarily can affect the development of the pregnancy through frightening situations or people that have touched dead bodies should not touch children because they can transmit an effect that determines a situation of anguish, anxiety, because a child starts with diarrhea, crying, fever, because of that spiritual contact that had through the hands of that woman that exhumated a body. We talk about the transmission of knowledge. The dreams of the Wayu culture are part of that methodology where those who were deceased and departed transmit the properties of the plants, what family, what person has protections for situations that are both organic or spiritual. So the dreams in the Wayu culture state that from those ancient dreams originated the craft of interpreting the principles of diseases, from which it was possible to interpret them as abnormal existence that attack and are incorporated in the human being to cause the denial of life. act of dreaming became an elementary formula to decipher the great secrets of nature, as well as to interpret the phenomena that disturb the physical and spiritual state of people. One of the actors that are part of our traditional system in YU is that person that interprets dreams. We start from Mother Earth. We're not disconnected. We're not disconnected of all the elements that are part of our environment in our territory. We are born from the earth with a seed that germinates in a healthy way. And in that life cycle, the YU women are the ones who care for that process. But of course, at present, those challenges are significant because there's been some effects on our territories. We have one of the large extraction of oil. Big companies have extracted and produced coal, and extraction of gas have deviated our rivers, our life sources, such as water. So the earth is a mother and must be healthy for her children to be healthy. If we have a territory that has been affected, well, it has men or women with bad thoughts, that's going to affect us in a space of life of mutual correspondence. The Wayu are animists. They give life to all beings, flora, fauna, water, mountains, salt flats, natural phenomena that mitigate their relationship with nature and higher entities. It has a spiritual and symbolic material culture where religious magic rituals are transcendental for the Wayu. Everything has a soul, spirit, life. Everything is a step in the long road to eternity because the soul does not die. Next. Thank you. So that is why in that life cycle, we are going to insist in strengthening that knowledge, and we preserve those traditions that allow us to maintain in a healthy territorial space, becoming more difficult in this world where we coexist, where areas that we had to leave the territory and we have to migrate to the cities, and there's a deconfiguration of many of our structures and the spaces that we have to carry out these rituals that are going to allow us to have a healthy life. We have the birth ritual. The child is born, the boy and girl is born. There's a major celebration. We celebrate with all the elements of nature. We share, we give them presents, offerings to the child. From the moment that we receive the boy, we celebrate his birth so he can walk together with your grandparents, taking care of the sheep, of the livestock. You are going to protect the family. From the birth itself, at that moment that we receive them, they receive their function in society. It's not a boy that's going to be just roaming and thinking that they don't have a responsibility in the YU society. The girl also has a responsibility to transfer lineage, to give birth to Lepiayu, Ipona,
¿no?
Urariyu, and
Igualmente, pues, es la que en
that is the
determinados
one
ritos,
that
como
at
es
a
el ritual de la
certain point
iniciación de la
they
niña
have the
adolescente,
ritual of
los
initiation of the
comienzos de
adolescent girl
proceso de
when the
transferencia
transference process starts
de ese conservar la
of
salud,
that
cómo se va a
preservation of
desarrollar
health,
ella,
or
cómo
how
ella
she's
va a
going
tener
to
función como
develop
una mujer
as a woman
protectora,
who is
consejera
protective, who is a
del clan,
counselor
la de
of the
ir
clan,
también creando
and
o
also
espacios de
going to be creating spaces,
encuentro, porque las mujeres construimos un
meeting
apure que nos
spaces where we
permite a
build an
nosotras
apure that allow
ser
us
esas consejeras.
to be those
Tenemos igual
advisors or
los
counselors.
rituales de
We
protección
also have
como
the ritual of
revelaciones de los
protection
sueños.
against revelations in
Tenemos una
dreams.
sociedad muy perversa,
We have a very
en
perverse
que no les
society.
gusta ver
People who don't like to see
que uno esté sano,
and one is
vigoroso,
healthy,
feliz, alegre,
strong,
pero nuestros
happy.
ancestros a
But
través
our
de sueños
ancestors,
nos
through
hacen
dreams,
protecciones que
protect
permiten
us,
atender también a esa
that allowed us
espiritualidad
to
que
deal
también se
with this
siente en las personas
spirituality
en
that
el cuerpo.
also
También
gets
se
ill,
enferma
not only the
generalmente.
body, the soul can also
Los rituales de
become ill.
protección y
The
fortalecimiento de las
rituals of
energías
protection and
vitales.
strengthening of
Eso tiene
vital
que ver con
energies. And that has to do
aquellas figuras que
with
tienen hoy
those
día, como hacía
figures
Dalí,
that today, as
nos
Abali
enseña a
mentioned,
compartir este espacio de ver
of
mujeres
sharing the
jóvenes
space of
que
seeing
pueden
young
enfrentar
women who have
situaciones
to
en
deal
este mundo
with
intercultural,
this
situaciones
intercultural world. They have to deal with
situaciones
situations
que
that they don't understand,
que afectan
that
a esa
affect
vitalidad
that
que tenemos para esa
vitality
lucha, para
that we
esa
have for
resistencia
this
indígena, en la
fight
cual
and resistance,
lo que buscamos es
where we are
proteger el
looking to
territorio y
protect
todo lo que
the
cabe
land
dentro del
and
territorio,
everything
porque de esa
inside our
forma pues nosotros
territory,
estamos
because if they become
de
ill,
manera
we
en situación de riesgo, ¿no?
we are in at
Igualmente el
risk, situation of
diagnosticar,
risk.
el
And
ritual de
also
diagnóstico y
the ritual
tratamiento
of
de
diagnosis
enfermedades
and killing of illnesses
para las diferentes
that we have
patologías,
for the
llamarlas
different
así como
pathologies,
enfermedades orgánicas
calling them
o
as organic
las
diseases
enfermedades
or
de tipo espiritual.
spiritual diseases.
Cuando morimos, cuando ese cuerpo muere,
When we die, when that
también
body
hay un
dies,
ritual
we also
para
have
que
a
se
ritual
vaya limpio, para que se vaya
for
alegre, feliz,
so
a
he can
encontrar
live or
con
she
sus
can live
ancestros.
happy and
Hay
meet their
todo un
ancestors.
ritual de baño,
There's a
hay un ritual de quién hace ese
ritual
baño,
of
se
who
siente con
does
es
that
un
bath
acto de amor porque él
with love,
no se va a
because
reencontrar
he or
o ella se va a reencontrar
she is going to
con
meet
nuestras
again
abuelas, con nuestros
with our
abuelos, con nuestras
grandparents,
tías, con nuestros
with our
nietos.
uncles,
Entonces,
aunts.
es algo
So
que
this is
realmente
something
hacemos porque
that
como una gran fiesta,
do.
porque
We
el
do a
día
major
uno nos
celebration of
vamos a ver
a feast
en el acto
because
de la exhumación
in the
de esos restos. Y
years later
también
we
entonces
have the funeral
esa,
ritual of exhumation of
esa
remains.
alma de
So that
Helvira se va al cosmos,
soul
¿no?
goes to the
¿Sientes?
cosmos.
Noli, querida, vamos apurándonos, por favor, que estamos
Noli,
con el
we need to
tiempo.
hurry up.
Gracias.
Your time is
Entonces
running out of
vemos que
time.
desde la antigüedad se
So we
conoce y
see
se estudia el poder
that
curativo de las plantas, las cuales
the healing power of medicinal plants and bark has been known and studied
conocimientos
since
sobre las
ancient times.
hierbas
For the
medicinales
Wayu, knowledge
se han
about the
asociado
medicinal
como
herbs is generally
anteriormente a través
revealed
del sueño,
through
que
dreams,
existe un elemento
this being a very
importantísimo
important
dentro de la
element within the
evaluación,
Wayu
porque
culture,
existen
since
hombres y
there are
mujeres
men and
hierbólogos,
women dreamers,
más las mujeres
but the
hierbalistas,
women
que van a
herbalists and shamans in
vacilar esa
particular always possess
esa,
this,
esa
this
cualidad.
quality.
Siguiente. Siguiente.
Next.
Siguiente. Entonces, como ya
So,
mencioné,
as I
en
mentioned,
medicina preventiva existen normas que tienen que ver con la
we
higiene
have
personal y familiar,
standards
el saneamiento del
in
ambiente, la
preventive medicine with
protección de
personal
los
and family
derechos de
hygiene,
proteger los
environmental
derechos humanos y
remediation,
alimañas,
protection from
para pasar
mosquitoes
por
and
sitios
vermin,
donde
not to pass
hay
through
pulowis, que son como
pulowis,
los
places
fantasmitas, o
where
donde
the
abundan los
bad
malos
spirits
espíritus, de
abound,
prevenir accidentes, de
prevent
practicar deportes
accidents,
y jueves y de
to
aislar
playing sports and
unos
games
de
into
otros.
isolated people from each other.
hay actores, ¿verdad? Y si quiere van pasando por
There are
ejemplo,
actors,
el AUTS, que es la autoridad
the
espiritual en el mundo
Otsu,
Wayuu,
which is
que
the
es una
spiritual
persona
authority in the Wayu world,
de virtudes
is a person
esenciales
invested with
o
essential virtues,
trances que interpretan como la
obtained
incorporación
through
de un
trances that
seiyuu o un
interpret as the
espíritu
incorporation of a
protector
Seiyu or a
con poderes
protective spirit
sobrenaturales
with
que pueden
supernatural
rescatar al
powers that can
espíritu en
rescue a
situaciones
spirit
difíciles.
from
Es
difficult
seleccionado
situations.
por los ancestros
He is
para
selected by the
cumplir esa
ancestors to
función.
fulfill
Tiene
this
profundos conocimientos
function,
sobre la
has a
medicina,
deep
sobre la
knowledge of
farmacopeia,
medicine,
sobre la
pharmacopoeia,
psicología, sobre la
psychology,
parapsicología y es
parapsychology,
también
and
político.
is also a political actor.
Tenemos los yerbateros,
We have the
que son iguales en las
yerbateros,
demás culturas. Siguiente.
as
Tenemos
the other
también
cultures
las
has. We also
actrices
have
el
the
parto, pero también están
midwives,
las que
where we
acomodan
also
la
have the
mujer
ones
cuando un niño viene
who
en malas
adjust the positions of
condiciones.
the child
Tenemos
on the mother womb,
las personas que tienen el
and
don
we
de
have the
ver
person who
los
have the
sueños
gift or
y
faculty to have
los
dreams,
aumentamos. Siguiente.
as we mentioned.
Entonces,
So
tenemos también
we
los
also
que
have
arreglan los huesos.
those who fix
Y
bones,
el papel de la mujer indígena,
and the role of
preservación y
indigenous
transmisión
women
de
in
los
the preservation and
conocimientos
transmission of
indígenas
traditional knowledge.
en esta
It's a
crisis
challenge in this
civilizatoria. Es por eso
civilizational
que
crisis.
en
That is why
Venezuela
in
nace desde
Venezuela,
el Ministerio de
from
Salud
the Ministry
la
of Health,
Universidad
we
de las
have
Ciencias de la
the
Salud,
University of Health
donde
Sciences,
esta universidad
where this
también integra
university
los
also
saberes
integrates
de otras culturas, pero
the
también los
knowledge from
saberes
other cultures, but
de los
also
diferentes
the
pueblos
knowledge from
indígenas
the
de la
different
República
indigenous people in the
Nacional.
national
Un reto, un
territory.
desafío
It is a
dentro
challenge
de
within
dentro de este
this
sistema tan
system
tan dominante como es
that's
la
so
medicina
dominant, such as
occidental,
Western
con
medicine
esta
is,
hegemonía médica,
with this medical
con esa visión
hegemony and this
hospitalocéntrica, ¿no? Que
hospitalocentric
luchamos
vision
todos los días
that we
desde esa
fight every
concepción
day
como
from this
Universidad de las Ciencias de la
platform
Salud
as a University
en
of
cada
Health
territorio. En el
Sciences
Zulia
in each
estamos
territory.
en esta
In
apuesta
Zulia,
de integración,
we are
de sinergia, de mirar
having synergy
igual a igual,
of looking
de
at the
mirarnos
same level,
con
to look at each other,
reconocimiento, con respeto,
recognizing with
con
recognition
mucha
and respect
confianza
and a lot
para
of
así
trust,
sembrar
so
en
we
esos
can
futuros médicos,
feed in
enfermeros,
those or plant in
fisioterapeutas,
those future
odontólogos,
physicians,
la
nurses,
existencia de otros saberes.
the existence of
Le
other
damos las
knowledges.
gracias al organismo
Thank
andino
the
por
Andean
nuestro
organization for
pequeño
this
pero
small
importante
but
para
important space.
compartir
We
las
share
luchas que seguimos
the
haciendo
struggle that we
desde los
continue
espacios,
to have
desde los ministerios,
from the
desde las
ministries, from
organizaciones
these
internacionales,
international
para
institutions
mantener
who maintain
nuestros conocimientos
our
ancestrales y tradicionales,
ancestral and
a las
traditional
nuevas
knowledge
generaciones,
with the new
para compartirlos y
generations
como
and
una apuesta
as a
a otras
bet
formas
to
de
other
curar y otras
ways
formas
of
de vivir.
healing and
Anaya
living.
Watsuge. Gracias.
Thank you, Anaya
Muchas
Watsuge.
gracias, Noli, por tu
Thank you so
presentación.
much,
Realmente
Noli,
muy
for your
interesante
presentation.
en la
Very
cual has
interesting,
compartido con
where you have
nosotros
shared with
aspectos
us
muy importantes
very
de la
important
cultura wayuu.
aspects of the Wayu culture.
Voy a destacar
I
algo
would
que
like to
dijiste,
highlight
y es que
something
la
that you
tierra es
mentioned is
madre y
that
debe
the
ser
earth
sana
is our
para
mother
que
and
sus
must
hijos
be
sean
healthy
sanos,
so their children
señalando
can be healthy.
explícitamente que es
By
un espacio vital por
emphasizing that this is
existencia
a
y mutuo
vital space for
consentimiento.
existence and
Eso
mutual
creo yo que es muy
correspondence.
importante y
I
que
think that
debemos
that
de
is
tenerlo
extremely
en cuenta.
important and we need to keep it
También
in
otra
mind.
cosa para destacar
Something
es
else to
la
highlight
cultura espiritual
is
que
the
tiene
spiritual culture
esta cultura wayuu, ¿no?
this Wayu
Y
culture has,
simbólica, donde los
and
rituales
which is
mágicos,
symbolic, where
religiosos
the
son muy
magical and
poderosos.
religious
Resaltaste la parte
rituals are
espiritual,
very
reconociendo
important.
que todo
You
tiene alma,
highlighted that
espíritu,
everything has a
vida, y
soul, a
todo es un
spirit,
paso hacia la
and everything
eternidad,
is a step
es
towards
parte
eternity,
de la
is part
vivencia del día
of
a día
the
de esta
daily
comunidad.
living of this
También nos dijiste que la
population.
mujer preserva
You
la
also
vida, el
mentioned that
bienestar de la
women preserves
familia,
life,
pero
the
también la
family
medicina
well-being,
tradicional
but also
preventiva, cuidando
preventive
la salud
traditional
de esta
medicine,
familia a lo largo
taking
de toda
care
su
of the
vida
family health
a
throughout
través
their
de
lives
rituales y
through
ceremonias
rituals
sagradas,
and sacred
considerando
ceremonies,
que la salud no solo es
considering
física,
that
sino también es
health is not
espiritual
only
y
physical but also
destacando que
spiritual,
el alma
and
nunca
highlighting
muere.
that the soul never
También
dies.
es muy importante
Also very
todo lo
important,
relacionado
everything related to the knowledge transmission and the messages through dreams, and that we have people who are specialists in the interpretation and somehow guiding the YU people. You also pointed out that traditional medicine plays an important role and that they have actors who have the knowledge on the art of healing in the YU world and are also in charge of preserving the YU medicine. And as always, you highlighted that the role of the indigenous women in the preservation and transmission of traditional knowledge is extremely important, but it's quite a challenge in the current context that we are living with discrimination and other issues. Once again, thank you very much, Noli, for allowing us to learn more about the YU culture, and we invite you to stay in the room for the Q&A session. To conclude with the presentation, we have invited Dr. Vivian Camacho Hinojosa, National Director of Traditional Ancestral Medicine within the Vice Ministry of Traditional Ancestral Medicine of the Ministry of Health of the plurinational state of Bolivia. She's a high-level commissioner, Alma Ata, 40 years, of the region of the Americas for the Pan American Health Organization, coordinator of People's Health Bolivia, former representative for the Andean region in the Latin American coordination within the World Movement for People's Health. She's a Quechua midwife, promoter of respectful childbirth and ancestral midwifery. She has a master in agroecology and culture and endogenous development in Latin America, promoter of popular health with farmers communities, indigenous communicator, member of the Abya Network of Indigenous Communication, medical surgeon, specialist in interculturality in health, promoter of ancestral knowledge of indigenous people. Welcome, dear Vivian. The space is yours. Go ahead, please. Thank you, dear Gloria. Thank you to the Andean Health Organization. Greetings to Dr. Maria Carmen Calle. And here I will to present this sacred fire that we can come with us to each one of my sisters that have been sharing their word, their strength, the strength of our indigenous people. So I would like to share with you this sacred fire from our territory, the Collasuyo, Bolivia. We are part of Tahuantinsuyo. Collasuyo means land of multicultural, and with this sacred fire, ask permission to our territory and our words and minds and hearts so we can have the clear proposal, so we can always have this big love for our people that guide us. And this our Bolivia is building this plurinational state. We are a plurinational state and to recognize our ancestral knowledge. So my dear sisters, this little fire for you. Although I have a brief time, I'm going to take the opportunity because Bolivia recognizes our ancestral practices in different areas of administration and life organization in the different areas of how we develop in our communities. So the decolonization, working our traditional medicine, recognizing from the state, and other different instances that work directly with indigenous communities, because this is a majority in our territory. However, there's still more work to do. We need to create awareness and to move towards a life free of racism and violence against women. We still need that awareness that is going to coordinate with events like these ones, and we greet this event that the Andean Health Organization carries out precisely to strengthen the proposals that we have been working. And that awareness is created when we share our word, our experiences that we are carrying out, when we share that despite the difficulties, we're moving ahead as an indigenous community. Now, I'm the National Director of Traditional Medicine of our Ministry of Health of the plurinational state. And in Bolivia, we're the only country that has been recognized in this regard, but we still working to go into the universal health system, we are registering the traditional medicine information system. We have a registry of medical specialties as traditional physicians and midwives and spiritual healers and nature specialists. We also have the notebook for care and a manual to record the traditional artisanal product that we launched last week. So the local pharmacies can register their products and have sanitary registration, so this can also be disseminated. And I'm going to take this space to share with you our guide of traditional medicine to deal with COVID-19. This document has been worked since previous year, and this guide for traditional medicine and COVID-19 have made a large study of medicinal plants, the dosing and preparations based on a 4-year study carried out from the Ministry of Health together with other institutions and universities, with a natural history museum, together also with botanical natural museums. So these guidelines acknowledge from the studies that we've carried out, we have considered the knowledge of our most important ecological areas. So we have a variety of plans and proposals, but we also have showed the products that have been already registered from traditional medicine from these local pharmacies. So these products can also be available for promotion, and now we're managing the products to be available in other areas, and we have added a listing of traditional physicians who have their registration and the Bolivian government. So we are making progress in these efforts so ancestral medicine can be part and work together with the universal health system. There is a national policy of family health that has to be intercultural, which means that any national policy, our government is promoting that this dialogue of knowledge and this coordinated effort of biomedicine and academic hospital medicine has to go together with the community effort of our wise people. So in this effort and task that we're carrying out, it is precisely to complement knowledge. As our political constitution acknowledges, it is our right to have access to intercultural health. It is our right to have health through ancestral knowledge and our cultural identity. Although this is a major challenge, we have a small office with limited resources. However, we're doing the necessary efforts so we can reach all our territories and all the communities. From more grandparents that have taken care of us historically, because thanks to them, we're still alive as indigenous people. Many of us who were children did not have a physician, but we have our grandmother and grandfather who took care of us with plants, with ceremonies, with massage, with dreams. And all this, with all this ancestral knowledge that comes from a life paradigm, that this is a universe that's alive and we dialogue with it. So in those areas, Bolivia, following the social struggle, we get recognition from the plurinational state. However, there's always the threat, this issue that the rights are not guaranteed. We need to continue fighting for our rights. In 2019, when the fascist government, they deleted the traditional medicine ministry and different offices for indigenous people, and they also brought a Bible to condemn us again. So that means that perhaps our rights were limited, perhaps that Pachamama was the devil, and these absurd lectures from 500 years have to continue to perpetrate this genocide, colonial genocide. So our rights are to be defended on a daily basis. Our rights are for every day. We are in this effort of recognizing diversity, recognizing respect, that we are different, we are diverse, and life needs us like that, diverse and different. A mono-Western culture linked to capitalist market has made us think that we all have to be acted the same way, dress the same, and eat the same, think the same, heal the same for the dominant market. However, we that are different and dress different, eat different, dance different, because we have in that difference, in that diversity, we have our strengths. So we need to remember that the strength of diversity is precisely that. Diversity of thought sustains life, takes care of the biodiversity. So when we talk about the health of our communities and peoples and talk about plurality of knowledge, the intermedicality that both medicines have to dialogue, Western medicine and traditional ancestral medicine, we are talking of preserving diversity of life, preserving these resources and knowledge that are going to respond to a world in crisis, with war, hunger, climate. We need to remember that with social justice and fighting for our rights, we're going to continue creating awareness. And these events are precisely for that, to share the strength we have, the progress we've made, but also how we overcome these challenges, and also to give us strength, because as indigenous people, we are still uh, pressured by different countries of the world. We need to be together so our proposals can build these horizons to man outside, to have a good life, the dignified life that we are building when we hear each other and learn together. So this guideline can be downloaded from the website of the Ministry of Health, but also from our Facebook page of General Traditional Medicine is freely available and also being translated to English and French, because we are the only country that have a doc, technical document that considers traditional medicine. We know that we can add other things, but let's join efforts and listen to each other. So from this event and everything that's being done with the Animal Health Organization, we can have effective response in our territory from the respect of our diversity, cultural diversity, our ancestral health. Thank you very much, dear Gloria, sisters. It's a joy to share with you a lot of strength and warm. Although we are from, you see that the four, this star, we are creatures that come from cosmos. And at that moment that we pass through this earth, let's have a great path for the next generation, because that's how our grandparents taught us. Thank you very much. Thank you. We thank the intervention of Vivian and a recognition to their effort to Horas Conju to strengthen the recognition of traditional medicine. Thank you, Vivian. We appreciate the presentation of this traditional medicine for COVID-19. Highlights the use of medicinal plants and traditional medicine that has a sanitary registration. Also, the recognition of traditional physicians who preserve this rich ancestral knowledge that Bolivia has. This is a major step given in this country. Also, the importance to have dialogue in exchanging knowledge under respect to ancestral knowledges. We are aware that the dialogue of knowledge is a very important communication methodology that puts us horizontally to all of us and forces us to listen and to be listened. And we work in that, and we believe that only when we listen, we are listened, we're going to achieve the respect for traditional medicine. Vivian also highlighted that the universe is alive and we coexist with it, and the fight in the struggle for the ordinary population should be done every day, so we don't allow to lose our terrain. We recognize indigenous populations that are still not being recognized. And don't forget that diversity is important and the indigenous communities are part of a whole. We congratulate for this guideline to the Ministry of Health from Bolivia, very important for our countries, and I am sure that we're going to share and be able to take advantage in the good sense with this valuable tool. Vivian, once again, thank you so much, and we invite you to stay in this room. Now, we're going to, let's see, we're going to have our active pause. We've been sitting here for a while, and for others, who incentivize the well-being of those who join us in this virtual session. In the next few minutes, we will exercise with an active pause to stay healthy, combat stress, reduce work fatigue, and keep muscles flexible and healthy. Please go ahead with our active pause.
Los invito a todos a participar.
You are all invited to pause and participate.
Hola, hola, muy buenos días, buenas tardes desde el Organismo Andino de Salud y el Convenio Hipólito Unanue. Los invitamos a hacer esta pausa de relajación, un automasaje que te va a encantar. Siéntate, disponte de estos minuticos y empieza. Lleva tu cabecita hacia un hombro y hacia el otro. Empieza a dejar la relajación de tu cuello, de tu cuerpo. Inhala profundo, exhala, lleva la cabeza de adelante hacia atrás. La idea es que logres desconectarte unos segunditos de tu trabajo y puedas regalarte este pequeño automasaje. Lleva la cabeza hacia el hombro derecho, con la mano contraria vas a empezar a hacer punzoncitos desde el hombro hacia el cuello. Haces como si la mano caminara, punzoncitos con fuerza que realmente distensionen, todo el tiempo con inhalo por nariz, exhalo por boca. Eso es, de arriba hacia abajo. Ahora vas a colocar tu manita sobre el hombro y vas a empezar a hacer pequeños como pellizquitos del hombro hacia el cuello. Busca ese punto atrás de tu espalda que suele doler, que puede generar tensión y oprime. Esto también lo puedes hacer con un aceitico, una cremita. Ahí donde te encuentres, muy bien, regresa suave. Vas a llevar la cabecita al hombro contrario y nuevamente punzoncitos de arriba hacia abajo. Haz con la yemita de los dedos el movimiento, como caminando hasta el cuello. Inhala, exhala. Muy bien. Nuevamente manita sobre el hombro, pellizquitos de arriba hacia abajo. Intenta simplemente relajarte, descansar unos minutos. Haz movimientos acá en la zona del hombro. Masajeas, masajeas. Muy bien. Ahora vas a llevar tus dos manitas atrás del cuello. Vas a empezar a masajear y vas a hacer como que deslizan las manos de atrás hacia adelante, como si limpiaras tu cuello. Entonces, inhalo, exhalo, deslizo. Inhalo, exhalo, deslizo. Eso es. Ahora lleva tus manos hacia atrás. Mueve tus dedos de arriba hacia abajo, baja un poco tu cabeza y empiezas a hacer nuevamente los punzoncitos acá en toda la zona cervical, más que todo aquí donde inicia el cabello, masajea de forma circular. Este es un punto de tensión que nos ayuda a quitar dolor de cabeza, dolores musculares, eso es. Masajea de arriba a abajo, eso muy bien, con las palmas, con la yemita de los dedos. Muy bien, ahora vamos a terminar con un estiramiento que nos ayude a terminar de relajar. Mueve ahí los hombros, lleva la cabeza hacia un hombro, mantén ahí unos segunditos, recuerda la respiración, inhalo, exhalo, cambiamos, inhalo, exhalo, palmas en forma de oración, colócalas en el mentón y sube la cabeza. Mantén unos segunditos ahí, inhala profundo, exhala, ahora al contrario, hacia abajo, hazle fuerza con las manos, muy bien, regresa, eso es. A todos los países, Bolivia, Chile, Colombia, Ecuador, Perú y Venezuela, desde los Rasconu, les agradecemos por esta pausa de tranquilidad, relajación. Espero te haya gustado. Chao, chao.
Bueno, ahora sí,
Well,
vamos
now we're going to start a dialogue based on the questions asked by the audience. I invite the speakers to turn on their cameras during the development of this webinar. Dali, as well as Vivian, had to leave the meeting. Dali is in Bolivia, and they had to leave the meeting because so thank you, Noli. Avelina, could you start your video? And I'm going to share the questions, the people that are here with us. I have a question for Avelina. What do you consider that has been the impact of health, of westernized medical interventions in the Ashanika health in Peru? Go ahead, Avelina. Well, I'm very happy to share and to answer this question. It is actually a process of being able to find a solution or that well-being. However, it's completely different because we see the Western world in a different manner compared to the Ashanican people. But despite that, there's small barriers because we don't understand it. It's a culture that has their tradition and forms. However, we still have to work. We still see discrimination in some areas. However, there is also the Western care is being imposed and setting aside the traditional portion. But today, through the Ministry of Health, we are working. It's a constant struggle, actually, because it still needs a lot of work with the implementation and training of the human team that go to the community to be certain and to learn what is the indigenous knowledge. So there's been some clashes and disagreements. We continue working with indigenous leaders, but this still needs to be implemented. Thank you.
su cámara, ¿no? El micrófono, doctora.
Como siempre, ese es
Your
siempre lo
microphone.
logro.
I always forget
Una
to
pregunta
turn on the
para
microphone. I have a
¿Cómo
question for
percibe
Noli.
la participación de las
How do
mujeres
you
YU
perceive
en
the
el
YU
desarrollo
women
económico
participation
de
in
su
the
comunidad
political and
a
economic
nivel
area
nacional?
of your community and at the national level?
No te escuché bien, Glorita.
Gloria, could you repeat
pregunta?
the question?
Dice, ¿cómo percibe
How
usted la
how do you
participación de
perceive
las
the
mujeres YU
participation of YU
en la
women
vida política y
in the
económica de su
political and
comunidad
economic
a nivel
area of
nacional?
your community and at the national level? Well,
De mucha
actually,
incorporación, tanto en la República
if a
Venezolana
large
como en la
incorporation in
República
the
de Colombia,
Venezuelan
¿no?
Republic as well as the Colombian, the YU
Ha
woman
participado en
has
espacios
participated
políticos,
in
tanto
political
locales
spaces,
como
both at the
regionales,
local
como
level,
nacionales
regional level, and
e
national level,
internacionales,
and international,
donde actualmente, por
where at
ejemplo, con
present,
la
for
apertura
example,
de la
with
frontera
the opening
colombo-venezolana,
of the
se ha
Colombian and
sido
Venezuelan
invitado
border,
por los
we have been
empresarios para
invited by
escuchar
the entrepreneurs to
propuestas, para
listen to their
escuchar
proposals,
aportes que
the, con-
contribuirían a
the
la salud, ¿no?
contributions that will
Todo este
promote
tema
health and this issue,
económico
economic
que se
issue
dio de manera informal durante
that
todo este
we
tiempo,
had
¿no? Porque la
informally
frontera
for
ha
so long
estado
that the
cerrada,
border
¿no? Entonces
was
hay una
closed.
participación importante de la
So there's
mujer
an
guayú,
important participation of the YU
como
women
artesana, como
as
comerciante,
artisan,
como
as
médica, como
political,
médica,
as
realmente
physicians.
con hay aperturas, pero también es
There's an opening,
bastante
but it's
difícil,
also a
¿no? Porque
difficult world
mayoritariamente son hombres,
where
pero
majority
y
were
cuando
with
digo
men,
hombre es por todo un tema
and this is
de
because of
competencia.
an issue of competition.
Muchas gracias, Noli. Ahora
Thank
voy a
you,
pasar a la
Noli.
segunda
Now,
pregunta
for
para
the second
Adelina.
question
¿Podría
for
comentar cuál
Adelina.
fue su
Could you comment,
percepción
please, on your
en cuanto a la
perception
implementación de la
with
participación
regards
cultural ¿Qué, qué recomendaciones brindaría para mejorar las
what are the
intervenciones?
recommendations to improve the
Adelante, Adelina.
interventions, Avelina?
Doctora, ¿me podría volver a
Would you repeat the question?
el pensativo está empezando a llover?
Your
Y ahí
No te
your
preocupes.
sound is breaking up.
por favor, gracias.
Mira, nos dicen lo siguiente.
The question is the
¿Podría
following.
comentarnos
Could you comment
sobre su percepción
on your
en cuanto
perception
a la
in,
incorporación de la
in terms of
pertinencia cultural
incorporation
en el
of
mismo?
cultural pertinence in
¿Qué
the Ministry of
recomendaciones
Health?
brindaría usted
What
para mejorar
recommendations would
las
you provide
intervenciones?
to improve the
¿Qué piensa
interventions?
sobre la
What do you
incorporación de
think
pertinencia
about
cultural en el mismo y
cultural
cuáles serían sus
pertinences
recomendaciones?
in the Ministry of Health, and what would you
Excelente.
recommend?
Fíjese de que
Great. Well,
muy interesante la propuesta a nivel del
a
Ministerio
very
de Salud
interesting
a través
proposal
de la
from the Ministry
Dirección
of Health
de, digamos,
to
de Cultura, perdón, Dirección de
the
Pueblos
Office
Indígenas.
of Indigenous
Y yo
People,
creo que también
and
está
I
dado ya
think
según la normativa
that
el
according to
tema de
the
que hay que poner en
regulations,
práctica
it's
y
but
me
it exists,
parece
but it needs to be
sumamente
put into
importantísimo
practice.
para el pueblo
And I
ashánica, el
think that for the
pueblo
Ashanic
tradicional,
and the
porque
indigenous
estaríamos
people,
nosotros
it's
también,
important because
digamos,
we will therefore, or we will feel
identificados, ¿no? De
well
forma
identified
incluidos también
and
dentro
included
de las prácticas de atención
in
y
the
mejoraría también
care
la calidad de
practices, and
atención
the
para el pueblo
care
indígena
quality
porque
will improve for
estaríamos
indigenous people
incorporando de
because we
mejor
will be
manera y no
incorporating
solamente ello, ¿no?
the
Buscando
pertinence
el enfoque, ¿no?
and the
A través
approach
de, digamos,
through
pasantías, a través de seminarios,
fellowships, seminars,
y
workshops,
dar a conocer
but
también la
also
escuela en realidad
to
como ya
teach
lo mencionaba,
or
la escuela
promote,
intercultural,
as I
no
mentioned with this
solamente como
intercultural school,
conocimiento
not
teórico,
only
sino
as
como
theoretical
conocimiento
knowledge,
en
but also
práctica dentro
as
de
practical
los
knowledge
pueblos indígenas y de
in
esa
the
manera
indigenous people.
se va a mejorar
And
también
therefore, we're
las
going to
atenciones, pero
improve
también
care, but also
atenciones como en la parte registral, ¿no? Como por
in
ejemplo
the
la figura del
registration. For
seguro,
example,
puedan
the
ir
health
incorporándose también
forms
los
could
códigos de atención
use
a
the
las
care
enfermedades
codes
tropicales, las
of
enfermedades
tropical diseases
dentro de los síndromes que
within the cultural syndromes, so that can be added to documents and management within the Ministry of Health. And I think that we should also work delivery, vertical delivery, because I think that there is a large percentage of people that are afraid to go to the city or the hospitals because the delivery is horizontal, and in the communities, some feeding patterns are used or restrictions that have to do with spirituality and nature, and also with respect the Mother Earth. It has to do a whole set of knowledge for professionals and physicians who work in the Ministry of Health. With this contribution, we will be guaranteeing a good and quality care with cultural pertinency in indigenous populations, and there should be a health post with interculturally approach. Thank you.
Muchas gracias a ti, Avelina.
Thank you,
Entonces,
Avelina.
una pregunta para
Now I
ti.
have a question for
¿Ustedes han tenido
Noli.
experiencias de
The
armonización
experiences with
de conocimientos
harmonization of medical
occidentales o
knowledge or Western medical knowledge
con
with
lo que
traditional
usted
medical knowledge with YU?
considera que
What do
serían
you
los
consider
beneficios?
that will be the
Adelante, por favor.
requirements? Go ahead, please.
Sí, hemos tenido
Yes,
espacios de
we've had
encuentro,
meetings and
a
spaces.
través de, tenemos una experiencia muy hermosa
We have
que
a wonderful
fue a través
experience
de
through
tejido de un modelo de salud
of
Wayuu
a
que
YU
iniciamos
health
desde el
model that
organismo
we
andino,
started from the
el
Andean
organismo andino, con los
institution
ministerios de
and
salud
with the
de
Ministry of Health
Venezuela y de
of
Colombia, de
Venezuela and
Medellín.
Colombia.
Yo
From
creo
there,
que
I
están
think that
los encuentros
we have these
más visibles,
more visible
más
meetings,
desde
encounters
la institución, desde la academia,
from
¿no?
the
A través
institution
de las
and the
oficinas
academic
de
area
orientación al paciente
through
indígena,
the Indigenous
donde
Patient
hemos hecho
Orientation Office,
sinergia entre los
where we've
saberes,
made
por
synergy
ejemplo,
with,
la
for
paciente
example,
que va a una intervención
patient that's
quirúrgica
going to
realiza
undergo surgery,
un ritual
and once
de energización
a
previo
energizing ritual
a la
before
intervención quirúrgica y
the
fue
surgical
realizado
intervention
sin
and has
ningún
been carried out
tipo de
without
limitación en el
any type of
hospital de
limitation at the
Maracaibo,
University Hospital
como
of Maracaibo,
también los encuentros entre
as well as
parteras
the
y
encounters
médicos
between
ginecólogos
midwives and
en Nicaragua,
gynecology
una
obstetric
experiencia que tuvimos
physicians
con los Wayuu y con los
that,
indios en la tierra de Perijá,
in the
pero también
Perilla Highlands,
en el
for
hospital,
example,
en el
as well as
territorio de
in the
Paraguaypoa,
hospital and
incluso
the territory
a
of
través de los
Guaraguaypoa
acompañamientos que ha hecho
through
también el
these
organismo y el UNFA, ¿no?
meetings from
Hemos
UNFA
hecho
and the
con
Andean Health Organization, the
saberes
Ministry of Health,
de
with all
profesionales o
knowledge
sabedores
meetings of those who know
del arte de atención al
the art
parto
of
y a
delivery,
el
care,
nacimiento, ¿no?
and birth.
Requisitos, condiciones, mira, el tema
Requirements,
del
conditions,
reconocimiento del
well,
saber
the
de uno,
recognition of the other
al
one's
tener ese
knowledge.
reconocimiento del otro,
By
nosotros
recognizing
podemos
the other one
mantener
knowledge, we have the second step, which is the
al tener
respect.
ese respeto ya
And by
hay una
having that respect,
confianza,
there is
¿verdad?
trust
Para poder trabajar de manera
to
conjunta como lo hemos
work
hecho en la
together as
experiencia que
we've
tenemos de nuestros
mentioned,
egresados de la Universidad de las Ciencias
and
de
we
la
have
Salud
people that have
con las
graduated from
parteras,
Rand
con los
University
chamanes.
with midwives and shamans.
Ahorita la experiencia se limita
The experience is limited
el nivel hospitalario
to
y
the
en el
hospital
nivel
level
en la
and
comunidad
to the
cuando
community level
hay algún evento.
when there
Lo
is
básico es en esto, es el reconocimiento de
the
otros saberes.
the basic
Pero
recognition
se
of the
puede
knowledge of
tener
others. This
diferentes
can't
formas
be
como
measured. We have
mezclar,
different
por
ways of
ejemplo,
diagnosing,
otros puntos
but we
en
have
común,
other
¿no? Entonces,
common
esos
areas.
puntos comunes las
So those common
fortalecemos
areas
para
that we are
trabajar en
strengthening
ese marco, ¿no?
in order to work under that frame.
Muchísimas gracias, Noli, por
Thank you,
tu
Noli,
respuesta.
for your
Bueno, teníamos
answer.
más preguntas para
Well, we had questions for Dali and Vivian,
Al haberse tenido que
but they had to leave.
vamos a dar por concluido
So
este
now we're going to
espacio.
conclude this space.
Agradecemos las
We
preguntas
thank
realizadas.
for
No
the
vamos a
questions.
responder todas.
We're not going to be able
Vamos a
to
tener
answer
una
all of
mesa
them,
para definir
but we
vamos a
will
tener una
consider
mesa para
them
definir los temas de los
for
próximos
the
webinars.
topics of the next
Valoramos
webinars.
su participación
We
en
value your
todo
participation and
el
interest
webinar y durante las semanas que siempre nos
during
acompañan.
this webinar in the
Para cerrar
following
este
weeks.
espacio,
To close
solicito a
this
los
space,
ponentes
I
en
ask the
un
speakers
minuto
to
que
leave us a
dejen
message or
un
final comment
comentario o un
in 1
mensaje
minute.
final. Y vamos a hacerlo
And
por
we're going
orden,
to
primero Avelina y
we'll
luego
start with
Noli.
Avelina
Un
and then
minuto cada
Noli.
una
You
para
have
su mensaje
1
final.
minute each
Adelante,
for
por
your
favor.
final message. Go ahead, please.
Gracias, querida doctora
Thank
María
you,
Gloria.
dear Dr.
Agradecemos
Gloria,
a la doctora María del
and to
Carmen, a
Dr.
todo el
Maria del
equipo que está
Carmen and
aquí
the
de Horas
entire
ONU,
team from the
asimismo
Horas
nuestras
Conju,
compañeras ponentes,
also
querida
our
Noli, querida
speakers, dear
Aralee
Noli, dear
y la
Arely,
doctora que también expuso.
and Dr.
Estoy
Vivian.
totalmente agradecida en
I'm
representación del pueblo
really
ashánica,
grateful
la voz de las
from
mujeres
the
que estamos
Ashanika
luchando
people,
para
from the
salud,
voice of women that
bienestar de
are
nuestra familia,
fighting for the health and well-being of our
nuestro diario
family
vivir.
with the slogan Good Living.
Estamos totalmente agradecidas ya que
We are
vivimos esta
very grateful
semana, la
because this
semana
week,
de los pueblos
this is the
originarios.
week of
Creo
the
que
original
se ve
peoples.
muy enaltecido este
This,
curso o
this
este
course,
diálogo
this
para poder
dialogue
ver
is
cómo
so
podemos
important
trabajar, cómo
to
podemos
see how can we
implementar el tema de la
do
salud
the
cultural y
implementation and work in the
sociocultural
intercultural
dentro
health
del
and
gobierno
strengthen it
nacional.
at the level of the central
Nosotros los
government.
pueblos ashánica existimos
We, the
para
Ashanika,
ustedes
exist
que
and
también
are
merecemos una buena
beings that
atención y
deserve
calidad
a
para
good
atender al pueblo
quality care
originario con la pertinencia cultural.
with
Entonces,
cultural
yo creo
longing.
que
So I think
estamos
that
muy satisfechos y
we are
contentos de
very
haber
satisfied and
participado
happy to
y sobre todo, pues,
participate
la
in this
gratitud es
event.
inmensa.
And
Sí, gracias por todo
thank you
y por
so much
acompañarnos en
for
este
everything
espacio.
and being
Razón
with us in
kisa
this
en
space.
Shaninkaite no Betsaheiti Pia Kameka Nampi Teki no Kimo Shireta
She's
Kancharos
speaking
Aramena
in the local
Kanchaite Oramena Jeroka
language.
Atima Orameka Oram Kimo Shiretansi, ¿no? Entonces eso bueno, estoy diciendo en mi idioma
I'm
Shaninka, ¿no?
speaking in the
Agradeciendo
Ashanika
al pueblo
language, thanking
Shaninka
everyone
por este espacio.
for this
Gracias.
space. Thank you.
Muchas gracias a ti, Avelina. Ahora
Thank you,
Noli,
Avelina.
tu
Now,
mensaje
Noli,
final.
your final message.
Bueno, mi mensaje se
Well,
basa
my message is
en
based in this
agradecer
thanking
estos espacios que nos
for these
permiten tener
spaces
una
that
voz
allow us
colectiva
to have a
de,
collective voice
de intercambio,
of
de
exchange
la reflexión de los tiempos en que estamos viviendo para
of
esta
the times we
construcción
are living at
que
this
no debe
moment,
ser
that, this is not
impuesta
going
solamente desde los pueblos
to
indígenas, sino también las
happen
instituciones,
from
los
the
lineamientos
original
políticos que
people,
nosotros
but also
nosotros
with the political guidelines that the
establezcamos
ministries are going
conjuntamente
to
con
draft
nosotros en una
together with
participación
us,
directa,
with
protagónica,
direct
pero también desde el
participation,
fortalecimiento nuestro
but also for our own
de
strengthening
sentir, pensar y
of thinking,
actuar
feeling,
como
and
indígenas,
acting as indigenous
en resistir a esa
to
colonización
resist that colonization
que estamos expuestos siempre
to
a
which we are
que es mejor que
exposed,
lo nuestro. Yo
that
creo
the other
que
thing is
la
better than
sinergia
ours.
entre ambos
I think
saberes
that
lo
the
que nos va a
synergy
permitir
between both
seguir
knowledges is going to
construyendo
allow us to
ese buen
continue
vivir. Gracias,
building that
Gloria.
good living.
Gracias, María
Thank you,
del
Gloria.
Carmen.
Thank you,
Gracias,
María del Carmen.
Jorge. Gracias,
Thank you,
Avelina,
Jorge,
por
Evelina,
permitirnos ser
for
las voceras.
giving us the opportunity
A
to
ti,
speak.
Noli, gracias por
You,
todo el
Noli,
apoyo
thank
y
you
el
for
servicio
your
que nos
support.
brindas y nos continúas brindando. Reiteramos el
We
agradecimiento a
reiterate our
nuestros
gratitude
excelentes
to our
ponentes
excellent speakers
y a todos los
and
asistentes
to
que
all
nos van
the
a seguir
attendees who
acompañando.
accompany us week after
Un
week.
agradecimiento muy especial a todo
A
el
very
equipo del
deep
Horas
thank
ONU,
to the
al
Horas Conju
traductor,
team, to
y
our
a todos los que
translator,
participan en esta
and to all of
actividad.
those who
Y
participate in this
gracias al
activity possible,
compromiso por la
thanks to the
integración
commitment to
latinoamericana.
the Andean and Latin American
Ahora,
integration.
con mucho
Now,
agrado, cedo la palabra
I'm
a la
pleased
doctora
to
María
give the
del
floor
Carmen
to
Calle
Dr. Maria del
para el
Carmen
cierre
Calle
de
to close
este
this
webinar
webinar
en nombre del
on
organismo
behalf of the
Universal.
Andean Health
Doctora
Organization.
Calle, por
Go
favor.
ahead, Dr. Calle.
Bueno, mis primeras palabras
Well,
son
my
de
first words
agradecimiento a
are
nuestra
to
querida
thank our
ponente.
4 speakers.
Me he sentido muy
I
contenta
felt
con este
very
webinar
happy with this
porque
webinar
yo creo que
because
hay
I think
espacio para
that
todos.
there's space for
Hay
everyone.
espacio para todos
there is space for everyone,
y todos nos necesitamos.
and we all
El
need
día
each
que
other.
los adultos
The
comprendan
day
esta
that the adults understand that there
interdependencia,
needs
es
to
que
be
ya
an
las cosas irán
interdependency,
mejor.
that day things
Y
will
que la
be
persona que
better,
está al costado
and that the person that is
tiene
next
no
to you
solo derechos,
has the same rights
y cuando estoy hablando de
that
la persona que
one
está al
has.
costado es
And when I talk to the person next to you, it's any person
yo
next to
creo
you.
que ese es el
And I think that
pensamiento,
that
el
is
pensamiento
the
del organismo andino de salud.
way
Nosotros
how we think in this
trabajamos
Andean
para
Health
contribuir al
Organization. We work to
bienestar,
contribute to
para
health
la
and
defensa
well-being,
del derecho
to
y para
protect the
disminuir las
rights,
desigualdades.
and to
Y
decrease
sabemos de la
inequalities. And we know
interseccionalidad.
about the
Sabemos
intersectionality.
que el ser mujer, que
We
ser
know that being
indígena
woman,
o
being
ser
from the
originario,
Andes,
ser
or being
rural,
originary, being
puede
rural,
tener
or
más
disability,
altibajos, más peros
those add butts
a nuestro
to
derecho
our
a la
right of
dignidad.
having a
Yo creo en la vida.
dignified life. I
Yo
believe
creo
in
la vida
dignified
me ha
life.
enseñado mucho. Yo soy
Life has taught
pediatra,
me, I'm
egresada
a
de la
pediatrician, I
he tenido la
graduated from
posibilidad de
Cayetano,
estar en contacto
but I've
con
had the opportunity to
todos
be in
y con
contact with
todas.
everyone.
Poblaciones con mayor vulnerabilidad,
Populations that have higher vulnerability,
llenas de
and
orgullo
populations full of
por ser
pride of
originarias.
being
Yo
original.
nunca me voy a olvidar
I'll never
estar
forget,
en el Cusco con
I
una
was in
reunión
Cusco
de
in a
no sé
meeting.
cuántos representantes
I don't know how
y
many
estábamos
representatives,
definiendo
and
qué
we
era
were
la salud.
defining what
Y la mejor
health,
definición de
and the
todas
best definition
fue
from
de
all
una
came
representante
from a
de población
representative
andina.
of the Andean
Y,
population
bueno, definitivamente nos
that
gusta esa definición, es
definitely
decir,
would like
hay muchísimo
there
para
there's
compartir
so many to
y yo sí
share,
creo
and I do
en la
believe
diversidad.
in
Justamente por eso somos pocos,
diversity.
porque
That's
somos
why we're
diversos.
rich, because we are diverse.
Pero tenemos que
But
comenzar con el
we need to
respeto.
start
Yo
with
no sé quién de
respect.
ustedes dijo que
I don't know
primero el
who of you said
curso,
that first we need to
tú
learn.
no respetas lo
You
que no
don't respect what
conoces.
you don't know.
Y lo peor de todo es que
And
a
worst
veces
thing
hay
is that
discriminación
sometimes there
porque
is
no
discrimination
conozco.
because we
Esa es
don't know.
la verdadera razón, ¿no?
That is the real reason
Y
behind
me
this.
llena de orgullo pues que
And
haya
I'm very
mujeres
proud that our
pero también
women,
haya habido
women
juventud,
and
¿no? Que
youth,
son mujeres jóvenes
young
que
women, that
están apoyando.
means
Y ese es
that
uno de los
you're
comentarios del chat.
betting, and this
Hay
is one of the
mujeres
chat
jóvenes.
comments, they're
Eso es
young
lo que nosotros
women, which is
necesitamos.
what we need.
Necesitamos gente que sí
We
crea
need
en sus
people that
orígenes.
do believe in
Que
their
esté
origins,
orgullosa de
who
sus
are
orígenes.
proud of their
Porque miren,
origin,
no solo somos bla bla
and
bla,
we not only
tenemos una
yada,
política
yada,
andina.
yada, we have an
Política
Andean
que
policy
ha sido digamos, actualizada en el
that has been
2019,
updated in
en la cual nos
2019,
habla de esos
where
sistemas de
it talks about
información que no
those
incluyen
information
yo estoy
systems
ahorita
that
en el
would not
ministerio,
include.
incluimos todo lo de las ciencias,
When I was working in
pero
the
aparte
ministry,
de que
we
pones
included
una norma,
science.
¿qué otra
But
cosa que
one
sea
thing is to
real?
establish a norm, and the
Porque
other thing is to
ustedes
make it true,
también
making
lo
it
que
real.
ustedes dicen, la
And also what you
capacitación de nuestros
mentioned, training
profesionales de
of our
salud,
health
no
professionals,
solo con el
not
enfoque,
only
me
with the
encantó la
approach.
referencia que
I
hiciste
like
por
the
ahí, no
difference,
solo con el
not
enfoque,
only with the
sino
approach,
también con el
but
tema de
also
medicina
with the
tradicional, salud
topic of
intercultural,
intercultural
respeto,
health,
¿no? Todas
respect,
estas cosas.
all these
El
things.
otro tema que estamos
The
empujando
other
es
topic that we are
dar
promoting is this,
espacios
to provide
y tenemos
spaces.
un
And
comité
we
de
have
salud intercultural
a intercultural
muy
health
unido,
committee that's
con
very, very
ideas, ¿no?
active,
Que
full of
siempre
ideas,
está
that
haciendo
is
cosas
always
diferentes,
doing things different.
pero tenemos que aterrizar.
But we need
¿Y
to
el
land.
aterrizaje cuál es?
And
Que
landing
realmente se
implies
respeten
that
los derechos de
there's
todos,
respect
¿no?
for the right of everyone.
Yo fui parte de esto del
I was
parto
part
vertical
of
hace
this vertical
muchísimos
delivery
años.
many
Y
years in the
realmente
ministry.
las
And that's
mujeres
true.
no quieren venir porque
Women don't
quieren
want to
estar
come because they don't want
debajo
to
con
give
las, y
birth
seguimos haciéndolo
like we
igual,
continue
porque
to do.
en todas nuestras
Although
regiones
in all of
yo he visto
our
cómo
regions,
han
I've seen
adaptado el parto
how they
vertical,
have adapted the vertical
lo que no
delivery,
sucede en los hospitales grandes, ¿no? Pero
which
sí
doesn't happen
en
in
los
the
hospitales.
large
Por otro
hospitals.
lado, es
On the other
importantísimo
hand, it is
tener
important
una
to
política o
have
un plan como
a plan or a
sombrerón, ¿no? Como
policy
sombrero para todo lo que hagamos.
as a hat
Y
for
es
everything we
cierto,
do.
la política
And
que
that
salió del
is true.
organismo andino de salud
policies issued by the Andean Health Organization were useful for the national level. We were also in the time where the policies of Peru were issued, but once again, I said one thing is written and the other thing is what has been implemented. What should we continue doing? We should need to continue working with strength, and we have to. This is what we are lacking. We need to go into the young ones to incorporate, add to our trainings the importance of from the young. And I'm not talking of the medical school or psychology school or nursing school. No, I'm talking about children. Instead, being diverse is important, but we need to bet for knowledge and respect. We believe in diversity? Yes, we do. We believe in equity? Yes, we do. And inclusion. Thank you very much for the time you've given us. At this moment, we have more than 350 people connected, which is a large number in different countries. We're talking about our countries, but also talking about Argentina, Cuba, Guatemala, Honduras, Mexico, Paraguay, Uruguay, and the United States. I think that this is, we hope to have your collaboration at another time. And I would just like to say goodbye by thanking our excellent speakers, thanking Gloria, Rod, Milagritos, Yanira, Marisela, and all the group of the Andean Health Organization, to our interpreter, and also all the people that has to do with organizing the webinars. Don't forget that the next webinar is a very interesting webinar. We're going to talk about, we're going to do the presentation of the Lancet Psychiatry Commission on Violence Against Women and Impact on Mental Health. So we do the presentation at the Latin American level in our webinar next week. Thank you very much for your time.